I came into Dr. Hilers' office here about 4 months ago. When I came through the door, I could barely walk. I had a bulging disc in my lower back. At that time, I was pretty scared because of what the pain I was in. Through spinal decompression and his adjustments, within a week, I was back to being able to walk again. And being an avid tennis player, within shortly thereafter, I was back on the courts playing again. I feel amazing.
I hit my knee really hard one day, and instead of going away, it got so bad that I started limping. I don't want to be with this pain. So now I have my own stem cells and fresh stem cells in my knees. I am doing so well with my knees. I do yoga and I can do a lot. It was truly a fantastic outcome. I feel amazing.
I played tennis, I played golf, I was extremely active, and all of a sudden I felt I couldn't do the things I did before. Dr. Hiler provided a lot of adjustments, and I could feel that I could bend again without any problem. He is amazing, and I am able to do the things that I couldn't do for a while, and now I just feel amazing.
I hit my knee really hard one day, and instead of going away, it got so bad that I started limping. I don't want to be with this pain. So now I have my own stem cells and fresh stem cells in my knees. I am doing so well with my knees. I do yoga and I can do a lot. It was truly a fantastic outcome. I feel amazing.
I am a competitive ballroom dancer. My lifestyle was becoming impossible. I could not do what I do. It was affecting my day-to-day life, but more importantly, it was affecting my ballroom dancing. So I had stem cell about 8-9 months ago, and I have no pain anymore. I feel really good. I can live my life again, and I can do what I love to do. I feel amazing.
Okay, here we are with Kathleen. We're at Hiler Chiropractic Neurology and also our medical corporation, Feel Amazing Institute. Kathy, she first came to us with trouble with her legs. Was it your hands and legs or just your legs?
Just my legs.
Okay, and she was diagnosed with neuropathy. She went through some treatment, which I'll describe. But Kathy, how was it in the beginning? I don't even remember how bad it was. So tell us how you were dealing with this.
I was diagnosed with diabetes 14 years ago, and prior to that I was diagnosed with peripheral neuropathy. I had difficulty sleeping at night, a lot of stabbing pain, like walking on cut glass and burning.
Okay.
That sort of thing.
And was it affecting your balance as well?
Yes, it was. Yes.
Okay. So we did your stem cell injections, which
Yes.
is something new to our area. And also we followed up with more traditional therapies. And how has it changed since the beginning now?
I've had a huge improvement, especially after the stem cells. I also do the shock therapy at home. I also had the infrared lights here. Everything has just gotten so much better. I never expected this much improvement.
So were you on pain medicines?
Yes, I was.
How has that changed at all?
I'm off of them entirely.
Excellent. And then, just things that affected your life, like, going to the store and
Anywhere, yes.
walking behind the grocery cart.
Huge improvement.
Is there things you're able to do now that you weren't able to do before?
Oh, absolutely. I'm much more stable on my feet. The pain has all but gone, especially at night.
Okay, I understand you cooked 4 days of Christmas cookies. So I would imagine that would have been a real challenge.
Yes.
Prior, but
yes.
we appreciate those cookies.
Oh, I'm glad.
All right. Well, thank you, Kathleen. We're glad you're doing so much better.
I am too. Thanks very much.
My name is Mike. How are you? I'm feeling phenomenal. Thanks to Dr. Hiler. Let me just tell you where I've come from. I do have L2 and L3 disc problems verified by x-rays and a couple of pain management docs. I've had 3 lumbar injections which lasted a little bit of time and then didn't work at all. I've taken all kinds of pills and tablets, all kinds of patches, all kinds of anti-inflammatory gels. The day before yesterday, I was out of my mind. I could not sit. And I've got a cruise to Europe, the Mediterranean cruise, coming up in early August. And I really thought I was going to have to cancel that trip. My girlfriend suggested that I see Dr. Hiler. And, you know, quite frankly, I don't know what it is about how people think. I always think of a physician first, or some home remedy or analgesics or whatever. Unless you are really into the whole chiropractic scene, you don't think of your chiropractor right off the top. But I should have, because I came in with great pain, and in one session, Dr. Hiler improved me 60 to 70%. It was a night and day difference. This is my second treatment. I feel like a new man. I'm 74 years old, and I'm really a happy guy.
Mike, how long has this been hurting for, Mike?
This has been going on and worsening for several years, and I've tried, as I say, all manner of remedies.
Yeah.
And I really wish that I had come in sooner, because this is a fabulous treatment. I feel like a human being again.
So you had the 3 epidurals, and you also had physical therapy?
Yes. The physical therapy was maybe 6 or 7 weeks, and they do a good job, you know, but the massages they gave me on my buttocks only made the pain worse. It did not help me. So, as I say, I feel very grateful that I've come here and been able to get such great relief so quickly.
Thank you.
Okay, my name is Steve, and I'm a patient of Dr. Hiler at the Hiler Chiropractic Clinic. And I had some problems with neuropathy in my legs, my feet, and my arms and hands. And I was getting actually to the end of my rope where I didn't know what to do. I was on maybe 15 pills a day of different nerve medications, pain, muscle relaxers, and the whole deal. And I was getting to the point where I couldn't walk maybe 100 yards or so. I'd have to sit down, and I couldn't stand for any length of time. So I decided to give Dr. Hiler's clinic a try because of the condition I was in. When I went to see Dr. Hiler, he told me, give it maybe about 7 weeks, let's set you up on a program and see how you respond to it. I started seeing him, and I went from a condition where I couldn't feel my feet, the tops and the bottoms were completely numb, and my hands and my arms were numb, and I had shooting pains. After using his treatments, which is a rebuilder and which is a light treatment, and with his manipulation treatment on my lower back, legs, and feet, I have to say I'm at least 50-60% better than when I started back 7 weeks ago, which I didn't think would ever happen. To me, it's a big change due to the fact that how badly I am. So I had a traumatic neck injury and a spinal cord injury, which was the cause of a lot of my numbness and neuropathy and pain. But coming to Dr. Hiler's clinic was the best thing I ever did. I sat in bed one night. I got to the point where I just couldn't walk, couldn't make it just barely to the bathroom and back. I couldn't feel my feet. After coming here 7 weeks of treatment, I feel much, much better. And I just want to say, anybody with the same condition, with the same problems, you've got to get out to this clinic and let him work on you, and at least see if he can help you. It's worth the time and effort.
Today is 8/21/2017, and this is patient. What is your name?
Josie.
I'll let you say it because I can't pronounce it correctly. Very nice to see you today. And so this is a video testimonial. And what I would like to ask you first is, what condition did you have, and what had you been through prior to coming into our office for treatment with Dr. Gadaletta?
Well, it's been years and years of pain, going through different doctors, trying to figure out what's wrong with me. And many doctors told me I have to live with pain, to give up, this is it. And I just thought, I'm still young, that I'm giving up most of my life. The things that I like to do, I can't do anything really. And even if I just lay there, it'd be pain all the time. So finally I didn't know what to do. I was lost. Okay. So I was looking for somebody, to help me out, and then I saw the ad for this doctor. I'm like, well, it's not gonna hurt to try one more time. I've done everything, and it's not helping me. So,
So before we get into what happened when you entered here, can you give me some idea as far as what procedures, you said you saw several, what things have you had done, treatments that didn't help before?
I've had rhinoplasty. I've had my
Surgery?
I had surgery.
Carpal tunnel surgery?
Carpal tunnel
Okay.
surgery because of pain. I had acupuncture. I had a lot of prescription medicine given to me for pain.
Any shots?
Yes, shots.
Okay.
Shots and months and months of therapy, occupational therapy,
Wow.
every kind of therapy.
You have been through a lot.
Yes, and all testing to see, because I didn't know what I had, arthritis. What is it that I have? Why do I have so much pain? Was it going from, my wrist to my elbow to here to my back? It's like literally, it's like my whole body hurts. What's wrong with me? Where do I go?
Absolutely.
So, yeah.
Okay, so then you found us, you found an ad, right?
Yes,
and
I found an ad.
And you saw Dr. Gadaletta.
Yes.
And can you tell me what's transpired since you started your treatment here in Gover?
It got to the point, I was very active. I was one of those persons that, I got up, did my housework, clean, went to work, came back, and was ready to do other stuff. And basically, the last 2 years, it's just like I barely make it home. It's just like go to bed, and that's it. I don't do anything else. I gave up gardening. I gave up reading, because even like holding up a book was hurting my hands. I gave up crocheting, and that's, my doctor, the last one that I saw, and he's like, there's nothing else we can do about it, just have to give up. I'm like,
that's
it can't
not,
be. He
that's
was
not
like
a good
80,
answer.
maybe I'd be like, okay, but I'm like, but I'm 50, and I'm like, and even if I lay there, I have pain. It's not like, okay, well, then I can't do everything. I'm just gonna lay there and I have, and I'll be okay. But no, even laying there, I have pain. So just coming here, which I really, honestly, didn't think he was gonna help me.
But you were desperate, right?
But I was like, what's gonna hurt? What's gonna hurt? Let me try it. And just, just a change, how I feel, and just like, I think I was depressed, and just now that I feel like I can do things, and I'm crocheting, gardening, like working. I started doing squats and things like that, because things that just walking. Standing, doing dishes, a few dishes, not like hours and hours of dishes, but just one or two. Just things like that. That it was so hard to do. It's like, it's so amazing. I'm happy.
Yeah, good. So if 10 was where you were with your pain when you came in, and 0 is no problem, where would you put yourself on that scale?
It all depends, because my work is really hard. So I do have hard work. And that's why I told my husband, I said, I'm tired, but not tired like before, It's like, I'd say maybe 1 or 2. And some days there's nothing.
Awesome.
Yes. And I was taking a lot of pain medication too. And now I'm not over the counter. I leave every once in a while, but not like before. That was the first thing I would take when I got up, and the last thing I took because even, like I said, even when laying down, I had pain.
Well, you look, I have to give you a compliment. You look markedly younger than your age, because you told me you were 50? 50. So, and now I know you're going to be an advocate for chiropractic and a healthy lifestyle, because I know you were probably depressed, and now you're like, go get them, because you feel great and you can do all that you want to do. So that's what keeps this clinic full of patients. So.
My name is Dale. I've been coming to Dr. Hiller's office since December with severe leg pains in both legs. At night I had trouble sleeping because of the pain, and ever since I've been coming to the doctor, I have slowly improved tremendously. After going through the process and over the number of weeks that I've come, I'm at the point now where I feel that I'm 95% better than I was when I started in December. It definitely helps.
So Dale, what's better? Is it your walking, your sleeping? What have you noticed you can do that was a problem for you?
Mainly sleeping. Some nights I couldn't even sleep in the bed. I had to get up and go and sit in a chair because the pains were so severe. And it definitely has helped.
And have you been able to cut down your medicines at all?
I've been able to cut down to 1 pill instead of 3 pills a day.
Okay.
And I found that out through my wife. I cut me back and I didn't even know it.
Okay. How long did it take before you noticed the change? Was it the first treatment, or after a couple of weeks, or what did you feel?
I think it was probably after about the first 3-4 weeks. I definitely could start feeling the pain subsiding, and it definitely was starting to feel better. And I think it took about 3 or 4 weeks to really get over the initial pain, so that I could sleep at night. And as far as walking, I can walk much better.
How about your balance? Is your balance any different?
It might have been at the first part. As far as now, I don't seem to have any problem with balance.
All right, thank you.
You're welcome.
My name is Carol Geiger. I went to a stem cell seminar and met Dr. Hiler, and later found out that he was certified in vestibular disturbances. He checked me and used the Epley maneuver to help my vertigo, and lo and behold, I never had one more dizzy spell after that treatment. He's a miracle worker.
How long were you having problems for?
2 months after a concussion.
Okay. Very good, thank you.
You're welcome. Thank you.
Okay, we're here with Morag, and she's been coming here to Hiler Chiropractic for about 3 weeks, and she just wants to share her experience. So, Morag, let's tell us how you felt in the beginning and how it's changed to now.
Well, in the beginning, I thought there was no hope, actually. And I decided to come to Dr. Hiler to see if he could help me in some way with my dizzy problem and my balance problems. And the first treatment that he gave me, I was absolutely amazed that I felt so much better and I wasn't as tired anymore. So for me, it's almost like a miracle, because I had been to so many different doctors, and none of them could really help me, except, give me a pill here and there. So I'm totally amazed that Dr. Hiler has been able to help me.
How long were you suffering with that type of problem?
A year.
Okay. Every day?
Every day. It just got steadily worse.
Yeah. I imagine it was affecting your enjoyment of life.
Of course, yes, because I was tired all the time. And my posture was really bad. It was getting worse every day. But I'm feeling much better now. I'm able to get around more, and I don't feel that.
At first, and how it felt since then?
Well, when I was in here for my exam with you, you tested both legs from the knees down through my feet, and I had 100% no feeling in both legs from my knees down. And I've had 2 opinions like that. And we talked about having the stem cell therapy, and I decided to go ahead and do it. And I was here, and they injected me at 4:30 on Tuesday, and I went home and went to bed, and I woke up at 6 o'clock in the morning, and I could feel my legs and my feet. Now that is just like a miracle, because I just can't imagine how that could even happen. But I literally could feel them, and I still can today. I mean, it's just amazing. And one of the reasons that I know that it's true is a week before, I stubbed my left foot into the bed caster on the floor, and I think I might have broken a toe, but the whole thing was black and blue, and of course it never hurt because I had no feeling. But when I woke up that morning at 6 o'clock the next day, my foot was hurting. and that's one of the main reasons I know that it did work that fast, because I haven't had any feeling down there at all for a couple of years at least, and now my foot started hurting right after the injections.
All right. So I know you also had issues with your balance and walking. So has that changed in just 6 days as well?
Yes, I can walk easier. It's ever since 6 o'clock that morning, I have not used a cane, and I walk on my own. But my balance, I still have a problem with the balance. When I first stand up, I'm a little jittery on it, and I usually have to hold on to something for a second until I get my balance. But but the walking has improved. I don't use the cane anymore.
Yeah. Well, if you can feel your feet, you're probably safer driving as well, right?
Oh yes, yeah. I am a Uber driver, and I feel completely safe as this whole last week.